Hi everyone, my name is Dr. Daniel Clearfield. I'm a sports medicine physician in the North Richland Hills area, and today I'm going to be talking to you about running in the pandemic, and I'm also going to be talking about common problems in endurance athletes. I'm again, a sports medicine physician. I'm a team doctor with our United States Wrestling and Judo team. I'm the founder and medical director of Motionist Medicine Sports Medicine. We started in Lake Worth and we just moved to the North Richland Hills area. And when the Honor Connor 5K was going to be going on, I was going to be serving as the medical director this year, and I hope to have a long arrangement with the Honor Connor 5K. So I'm going to get right into it. So I always like to talk about that the first marathoner, Phidippides, collapsed and died at the finish of his race. And so we've definitely gotten better with our sports medicine ever since this occurred. But it is to show that running is a healthy activity, but things can happen. So we're going to go over common injuries and conditions. This used to be a much longer lecture. I have it abbreviated down just to have some succinct things as far as some common things that we'll see. And we'll talk about how they occur, how they're diagnosed, and how they're treated, and how they can be prevented. And then we'll also talk about COVID-19 and is it safe to run or not while this pandemic's going on. And I know that's a very topical thing to go over. So musculoskeletal problems, we'll be talking about these three guys right over here, very common things, and so we'll get right into it. So common cause, big ones are prior injury. Biggest risk factor for any kind of injury is having a prior injury to that area. So if you had an ankle sprain, more likely to sprain that ankle again. Overuse, and most of what I see in sports medicine is overuse. Yes, I see a lot of, hey, I tripped off of this curb, I got hit over on the ankle this way, but a lot of the times it's overuse, and I always compare it to a pot slowly boiling over. You don't notice until it's kind of boiling itself over. If you're running more than 20 miles a week, then that also lends towards these overuse type injuries. If we have any change in the frequency of activity, in the intensity, the duration of the training, or the type of surface that you run on, any of those things can cause more injury. The age of the shoes, and so that's a big one that I also like to consider. If you have shoes that are worn out, then they're not doing you much good because they lack the support to be able to support your body. And then lower quarter instability, and this is something that I frequently assess, making sure that you're not just having problems in the feet, but do you have problems in the ankles, in the knees, in the hips, in the back, the core musculature. If you have anything where there's an imbalance, then ultimately your body is going to have a recurrence of injury. And so that's one thing I really try to figure out to see if we have any kind of risk factors for future injury. So patellofemoral pain syndrome is the first condition I'm going to talk about, also called PFPS, also called patellotracking syndrome, anterior knee pain syndrome, patellofemoral dysfunction, or PFD. Again, very common, and also just called runner's knee. And so it occurs from that pronated foot, what we call an anterior pelvic tilt can lead to this, varus alignment of the knees, where the knees are a little bit more of a bow-legged kind of appearance, and an abducted gait. It's diagnosed typically clinically. We can sometimes do an x-ray, sometimes I can do a diagnostic ultrasound, but most of the time we can just figure this out just through doing a history and physical. What do you do to treat this thing? So big ones are rest, making sure that we're stretching the right kind of muscles, notably the hamstring muscles and the calf muscles, working on strengthening and notably of specific quadriceps muscles, notably the vastus medialis oblique muscle on the thigh, and then working on those biomechanical corrections. So having somebody that's skilled at being able to look at you biomechanically and being able to figure out where you're weak, where you're strong, where you're tight, where you're loose, and being able to work on those things. I try to avoid taping and bracing if possible. Sometimes orthotics can be helpful to help support those mechanics. Ice is my favorite pain medicine, and so icing for typically 10 to 20 minutes at a time, every 3 to 4 hours that you have the opportunity, tends to really do a good job of calming it down. If it's the knee that's irritated, the knee's a circular capsule, and so if you put a big bag of ice over the front of the knee and then have another ice in the back of the knee, it tends to work a little bit better. Using anti-inflammatories, non-steroidal anti-inflammatories like ibuprofen, naproxen, those type of things as needed, and acetaminophen APAP can be helpful as well. Very rarely do I need to do any kind of injections on this kind of diagnosis. Most of the time, we just need to make sure that we're giving them the right kind of training, but sometimes it's so flared up, it's so painful, or they have such looseness of certain structures that we have to do injections on them. And I'm a DO, and I do a lot of manipulation, and I do manipulation to help this condition as well. How can it be prevented? And we're going to have one slide that kind of talks about prevention for all these conditions. The next one I'm going to talk about is Achilles tendonitis. More accurately, Achilles tendinosis, because usually that's what we're feeling, more of a chronic, non-inflammatory, but a chronic wear and tear on the tendon. And this typically occurs, again, through that pronated foot, through a condition called ankle equinus. And, roughly, almost 2/3 of the patients have some sort of foot alignment issue, so that you need some sort of support in there or build up the arch strength naturally. It's diagnosed typically through a clinical mechanism. Things like musculoskeletal ultrasound and MRI can be very helpful. I do a lot of diagnostic ultrasound to see exactly how bad this condition is and what helps me kind of prognosticate as far as what kind of treatments we can do for it. What do you do to treat it? So we're seeing a little bit of redundancy of these treatment recommendations, but each thing, it seems like there's a similar kind of theme as far as how you treat it, but you have to tailor it to the specific condition. So it's making sure that you're stretching the right areas, again, strengthening the right areas. One of the big ones with this one is you really need to work on stretching out that Achilles soleus complex, gastroc soleus complex, and then as it goes into the Achilles, and then also stretching out the plantar fascia, because that tends to be a continuous fibrous structure that kind of goes from the back of the calf down into the foot. Again, working on those biomechanical corrections. For really bad cases, sometimes we'll put in a boot. I like to use a heel cup for this condition a lot as well, just something that kind of raises the foot up a little bit, and I have those available in my office. And very rarely do I need to do any kind of injection procedure, but I do a lot of manipulation on these structures as well. Plantar fasciitis, again, usually is a much more chronic natured kind of condition. It's typically hurting right on the bottom of the foot, and it's the most common cause of heel pain in adults. And so it occurs from, again, that either pronated foot or the pes planus, or a high arched foot also. So you need to kind of have that Goldilocks foot to reduce your risk factors. So if your arch is too high or too low, that puts you at greater risk. Abducted gait as well as ankle equinus are two structural things that we look for to see if that's leading towards it. Again, this is a clinical diagnosis. A lot of people will sometimes get an x-ray and they're told they have a heel spur. Heel spur is not the cause of the problem. Heel spur is a result of the problem. If you yank on a bone all day, where that plantar fascia is inserting on the bone, if that keeps getting pulled at that area, the body grows bone in response to that. The bone spur itself is not the problem, it's the tight tissue. And so if you work on the tight tissue, then sure enough, that the problem will heal itself. Once again, how do you hear it? How do you treat it? Rest, stretching, strengthening. Sometimes we use a thing called night splints, where it kind of holds the foot up in a little bit of a dorsiflexed, extended kind of position, which helps stretch that plantar fascia overnight so it doesn't hurt as much with those first steps. I'm a big fan of doing heel cups, if needed, inserts, especially if there's other structural issues with the foot. And very rarely am I doing injections on this that are steroid injections, but very commonly I am doing things such as regenerative injection treatments, such as prolotherapy, platelet-rich plasma treatment, some of these regenerative treatments, just because this tends to be a chronic issue. Sometimes it's really hard for the body to be able to get over itself on its own. And so what those do is they jumpstart the natural healing process. So from a prevention standpoint, best way to treat an injury is to avoid it in the first place. And this is a picture of my mother here with a "I told you so" face. And so what's the best way to kind of, be able to help prevent this? Make sure that we have adequate rest. Make sure that we are stretching, notably after we get back from a run when the muscles are nice and warm. Make sure that we're doing the right kind of strengthening exercises. And if you're only running, you should be doing some sort of strength training throughout at least once or twice a week to help maintain all that muscle that you're kind of building up. From a training standpoint, make sure that you increase the distance, frequency, or intensity gradually. That's the key word, over a period of time. From a nutrition standpoint, make sure that you have adequate energy, adequate hydration, and if you need it, make sure that you're having proper nutritional supplementation. Shoes and surface is a big one too, and so make sure that you're replacing your running shoes between 350 to 550 miles. It depends on if you're a big person. If you're 200 plus pounds, you probably need to kind of change out your shoes closer to that 350 mark. If you're a lighter individual, like 110 pounds, then 550 miles might be more than enough for you to be able to get off of one pair of shoes. So last thing I'm going to talk about is running during the pandemic. So this is definitely something that has been of concern for a lot of us. So big one, first of all, is it safe to run outside? And the answer is yes, but ideally running alone or with someone from your household. So that way you can just keep it familiar and you're not potentially spreading it to somebody that hasn't been in contact with you. In general, just staying away from crowded areas. Time your runs for when you know trails aren't as crowded. And then one thing is that 30 to 60 minutes of brisk exercise per day does strengthen the immune system. So exercise is the best medicine that you can be doing, but you just want to make sure that you're doing it safely when you do it. Do you need to wear a mask when you're running? And the answer is no, probably not. But if you are anticipating being around groups of people, but again, going back to that first question, ideally trying to run alone and stay away from groups, so then we probably don't need to wear a mask. So if you're feeling sick, it's probably not smart to go out on a run, okay? Because when you're breathing, when you're coughing, you're putting that out in the air. And so even though you could probably withstand it, you don't want to be getting somebody else sick. You want to continue hand hygiene, social distancing. Should you avoid running in groups? And the answer is yes. Should you avoid touching traffic buttons? And the answer is no, but ideally if you can use a glove, your sleeve, an elbow, and then definitely try to avoid touching your face because you just don't know who has touched that traffic button already. Is COVID-19 transmitted through sweat? And to our knowledge right now, no. And that's actually, there's been some studies on this. And this is information that has come from the Mayo Clinic, from Stanford Medical Center, as well as the CDC. Are you contagious if you're asymptomatic? And the answer is possibly. We still don't know who potentially is asymptomatic with this, who is slightly symptomatic, and some people who are symptomatic, we don't know if it's exactly COVID or if it's something else. So if you're asymptomatic, then you still might be a carrier of this, and so still, you just want to be careful, don't give it to anybody else. Is your immune system vulnerable after a longer race? And the answer is yes, but that's usually after a half marathon or longer. That's where your immune system can be temporarily kind of weakened, shocked, and so that's where you would be a little bit more cautious. If we're just doing the 5K, no worries with that. Can COVID-19 be spread through spit? And so this shows somebody doing a snot rocket. So yeah, if you are going to spit or blow a snot rocket, you can really see how it's fanning out over the area, and it can stay in that airspace for a while. So if you see somebody spitting ahead of you, either change direction or really try to detour around it so that you don't go through that kind of region where you could potentially be exposed to whatever's stuck in the air. How long can COVID-19 live on clothing? And hours to days. It really depends on the type of cloth, the fabric, the moisture of the fabric as well. So, pretty much if you suspect that you might have clothing that was exposed to it, then take it off and get it, right in the wash so that you can get it clean. Last little slide here I'm just going to have is some tips on fluid replacement. So in general for a 5K, really don't need to worry about much, but it is good to have about 400 to 600 cc's or about 1.5 to 2.5 cups of water. During the event, every 15 to 20 minutes that you're running, you want to have about 1/2 to 1.5 cups of water. And then about post-event, you want to have roughly about 2 cups per pound of weight loss. So if you're doing anything, we're really not worried about too much weight loss with a 5K, but as you get into 10Ks, half marathons, triathlons, that's where you have to be a little bit more diligent. In general, you don't need to be using Gatorade for hydration if it's less than 1 hour. But if you're going for longer than an hour, then having a 4 to 8% carbohydrate concentration, so watered down Gatorade kind of product can be helpful at that point. So this is my family here, and so we're trying to keep them nice and active. Got Hannah at 14, Lainey at 5, and Campbell at 8. And we have little baby Clearfield that is on the way, coming soon. This is our family with our dog Cody right over here. If you're interested in coming in to see us in our practice, we treat all ages of athletes from 5 years old and up. I treat from toes to nose, and so we take care of sports medicine, non-operative orthopedics. I do a lot of osteopathic manipulative medicine in my practice, regenerative medicine, concussion management. Go to our website, motionismedicinedfw.com. Check us out, see if we can help you. I'm not content with anybody who says that they can't do anything. I'm not a can't-do doctor. I try to keep you moving. My goal is, that we're going to be able to figure out what's going on with you, get you better, get you discharged from our practice, and then hopefully have you refer somebody else to us. So life is too short to live it in pain. Come see us and we will get you moving. And be sure to follow us on our social media also. So we have our website, we have our Facebook group, Motion is Medicine DFW, our Instagram site, Motion is Medicine, Sports Med, and our Twitter is @MotionIs. And we try to have fun updates on there. We try to have promotions on there, helpful fitness tips. So definitely be sure to follow us. Thank you very much, everyone. Have a great day.